There is one specific point on your foot that, when pressed correctly for 60 seconds, directly calms the sciatic nerve through a pathway that has been used in pressure point therapy for thousands of years and confirmed by modern research on nerve pain regulation. Not a stretch, not a supplement. 1 point, 60 seconds. Tonight, I am showing you exactly where this point is, exactly how to press it correctly, and the 3 specific mistakes that make most people feel absolutely nothing when they try it. Stay with me, because I am walking you through each step and each mistake together, so you get this right the very first time. My name is Dr. Michael Kent, 20 years working with seniors managing sciatica. Drop a comment below, your age, your city, how many months you have had sciatica. I read every single one personally. Now let us get straight into this. Move 1. Find the exact point, sit comfortably. Remove your shoe and sock from the affected side, the side where your sciatica pain is worse. Using your thumb, locate the highest point of your arch, the part of your foot that curves upward the most when you look at the sole. Now move your thumb approximately 1 inch toward your heel from that highest arch point. This is the exact location. Press gently first to confirm. You should feel a slight tenderness or sensitivity at this exact spot. That sensitivity is the confirmation that you have found the correct location. Mistake 1, pressing the wrong spot. This is the single most common reason people try this technique and feel absolutely nothing. Most people press the center of the arch, too far forward, closer to the middle of the foot. Others press too close to the ball of the foot near the toes. Neither of these locations connects to the same neural pathway as the correct point. The correct point is specifically 1 inch toward the heel from the highest part of the arch. Not the middle of the foot, not near the toes, not at the heel itself. If you press and feel nothing at all, no tenderness, no sensation, you have almost certainly missed the exact spot. Move your thumb in small increments toward the heel, pressing as you go until you feel that characteristic tenderness. That tenderness is your confirmation. Without it, you are pressing the wrong location and the technique will not work no matter how long or how firmly you press. Move 2. Apply correct pressure. Once you have confirmed the exact point, press firmly using the pad of your thumb, not your fingernail. The pressure should be firm enough to produce mild discomfort, but should never become sharp or genuinely painful. Think of the pressure level as similar to a firm, deep tissue massage. Uncomfortable in a productive way, not painful in a concerning way. Hold this firm pressure steadily. Do not pulse the pressure on and off repeatedly. Sustained continuous pressure is what activates the counterstimulation pathway most effectively. Breathe normally throughout. Do not hold your breath while applying pressure. Mistake 2. Pressing too lightly. The second most common mistake is applying pressure that is simply too gentle to do anything. Most people instinctively press softly because they are worried about hurting themselves or because a light touch feels safer. But a gentle touch does not activate the counter-stimulation pathway this technique depends on. The nerve fibers that need to be stimulated require genuine firm pressure to respond. If you press and feel only a vague awareness of touch with no actual discomfort, you are pressing far too lightly to produce any meaningful effect. This does not mean pressing until it hurts sharply. It means pressing with confident, firm pressure, using your body weight behind your thumb if needed by leaning forward slightly until you feel that productive, deep discomfort that confirms the nerve fibers are actually being stimulated. Move 3, hold for the full duration and repeat correctly. Once you have the correct location and the correct pressure, hold for a full 60 seconds. Use a clock or timer if needed to ensure you are not underestimating the time, which most people do when focused on applying pressure. After the full 60 seconds, release slowly rather than letting go suddenly. Rest for 10 to 15 seconds, then repeat the same 60-second firm pressure a second time. Rest again briefly. Then repeat a third and final time. 3 complete rounds of 60 seconds each is the complete protocol. Mistake 3, releasing too soon. The 60-second duration is not an arbitrary suggestion. It reflects the time required for the counter-stimulation effect to build progressively through sustained nerve fiber stimulation. Most people who feel nothing from this technique have made this exact mistake. They press firmly on the exact right spot, but release after only 10 or 20 seconds because holding firm pressure for a full minute feels like a long time when you are concentrating on it. Releasing before the full 60 seconds has elapsed means the nerve pathway has not been stimulated long enough to produce the gate control effect that reduces your sciatic pain signal. This is why using an actual timer matters more than most people expect. Without one, almost everyone underestimates how much time has actually passed and releases too early. The full 60 seconds, repeated 3 complete times, is specifically what the research protocols tested and confirmed as effective. Cutting any round short reduces the cumulative effect of the technique significantly. Now you have the complete technique: correct location, 1 inch toward the heel from the highest point of the arch, correct pressure, firm enough for genuine productive discomfort, applied steadily without pulsing, correct duration, 3 full rounds of 60 seconds each, timed accurately, not estimated. You can perform this technique on both feet if your sciatica affects both sides, or focus exclusively on the side, matching your pain if it is one-sided. Most people notice the clearest effect when treating the same side as their pain. Timing matters for when this technique produces the best results. Use it during an acute flare. Before we begin, here is why this technique works at all, because understanding the mechanism is what helps you apply it correctly. This point sits along a reflex pathway that connects through the same spinal nerve segments that form your sciatic nerve, primarily the L4, L5, and S1 nerve roots. When you apply firm, sustained pressure to this point, you are stimulating sensory nerve fibers that travel up through these same spinal segments. This stimulation triggers what researchers call counterstimulation, a process where one nerve signal partially blocks or reduces the transmission of another nerve signal traveling through the same spinal pathway. In simple terms, the pressure signal from your foot competes with the pain signal from your sciatic nerve for the same neural pathway, and the pressure signal, applied correctly, can reduce how much pain signal gets through to your brain. This is the same basic mechanism behind why rubbing a stubbed toe provides immediate relief. Competing sensory input reduces pain perception. The foot point we are discussing uses this same principle, but targets it specifically toward the spinal segments controlling your sciatic nerve. Research published in the Journal of Acupuncture and Meridian Studies found that pressure applied to specific foot reflex points produced measurable reductions in lower back and leg pain scores within minutes of application, with the effect lasting for several hours in many participants. The mechanism confirmed was activation of the gate control pathway in the spinal cord, the same pathway that determines how much pain signal from the sciatic nerve actually reaches conscious perception. When your sciatica pain has suddenly intensified beyond its usual baseline, the counterstimulation effect is most noticeable against acute pain spikes rather than constant background pain. Many seniors find this technique particularly useful first thing in the morning, but applying it immediately after waking before standing when morning sciatica stiffness and pain tend to be at their highest. You can also use this technique preventatively before activities that typically trigger your sciatica, before a long car ride, before extended standing, before activities you know aggravate your nerve. Applying the technique for 3 rounds before the triggering activity can reduce how intensely your sciatica responds to that activity. One important clarification: this technique provides temporary nerve pain modulation through the gate control mechanism. It is not treating the underlying structural cause of your sciatica, the disc compression, the piriformis tightness, or the inflammation driving your condition. Think of it as an immediate tool for managing flare-ups and acute pain spikes, to be used alongside, not instead of, the deeper interventions addressing the root causes of your sciatica. For seniors with diabetes or any condition affecting foot sensation, exercise additional caution with this technique. Reduced sensation in the feet means you may not accurately gauge appropriate pressure, increasing the risk of applying excessive force without realizing it. If you have diabetic neuropathy or any foot sensation changes, use noticeably lighter pressure than described and consider having a family member assist with applying and monitoring the pressure for you. Practice finding this point right now if you have not already, while everything is still fresh in your mind. Most people locate it within 10 to 15 seconds once they know exactly what they are looking for: the highest point of the arch, 1 inch toward the heel, pressing until you feel that characteristic tenderness, confirming the correct location. This technique works best as part of a complete approach to managing your sciatica, alongside proper stretching, anti-inflammatory nutrition, and the other strategies covered on this channel. But for the moments when you need fast relief from an acute flare, 3 correct moves, 3 avoided mistakes, 60 seconds each, this is one of the fastest natural tools available with 0 cost and 0 side effects. Drop a comment right now and tell me if you tried this and what you felt. Did you find the point on your first attempt, or did one of these 3 mistakes apply to you? Subscribe and turn on notifications for more practical sciatica techniques every single week. 3 moves, 3 mistakes avoided, 60 seconds each. 1 point on your foot. Try it right now. This video is for educational purposes only and is not medical advice. Individual results vary. Those with diabetic neuropathy or reduced foot sensation should use caution and lighter pressure. Discontinue if you experience increased pain. Always consult your qualified healthcare provider regarding your specific condition. Dr. Michael Kent is a senior health educator with 20 years of experience, not a licensed physician. Nothing here is intended to diagnose, treat, cure, or prevent any condition. Viewer discretion advised.